Thank you, Governor. Good morning. It's great to see everyone again. Dr. McDonald could not be here today and asked me to join the Governor, and I'm pleased to be here to talk on behalf of the Rhode Island Department of Health and my colleagues, Anna, about the shift in our risk assessment framework that the Governor just mentioned. First off, though, I want to say I'm thrilled where we are. The Governor just mentioned case counts are coming down, hospitalizations are coming down. We're in a great place, so much better than we were a month ago, and I'm thrilled about it. It's very timely that we're talking about where to go from here and thinking about the future of addressing COVID here in the state. So as the Governor shared, the CDC announced a new approach last week to help states and communities think about the local risk of COVID-19. This is intended to replace the previous system, which was based only on case counts. The older system, the one that we were using that was widely used across the US, other states, other media outlets, was based on the number of cases per 100,000 in the last 7 days, and it was a 4-tiered system. For people that have followed our data hub closely, our website, it's been located in the top left corner of our website. The new tiered system, which the CDC and states across the country are adopting, is action-oriented, it's comprehensive, and it makes a lot of sense. And frankly, it's a lot of what we've been doing anyway and the way that we've been thinking about how to move forward to address the pandemic. This new system looks at risk levels using low, medium, and high tiers, and it tells what steps you need to take in order to keep yourself, your family, and others around you safe and healthy. It's more comprehensive because in addition to the community rates, it includes hospital capacity and hospital admission rates. And as we all know, hospital capacity has been a significant challenge throughout the entire pandemic. This helps us account for situations when we may see a lot of cases, but a relatively lower number of hospitalizations. Part of what we're thinking is to make sure to address and keep our hospitals safe, because when hospitals become overwhelmed, not only do COVID patients start to die, but people also have suboptimal care outcomes due to other things. We remember some of those stories about people having to drive, not here in Rhode Island, but in other parts of the country, people having to drive hours away for a heart attack or a stroke because they couldn't access the hospital right in their own local community. These additional hospital metrics also help us account for the fact that many people are using at-home tests, which is a good thing. And however, these are not usually reported to us at the state level. It's been difficult to keep track of them. I'll also add that incorporating this hospital capacity metric into a risk assessment level helps us prepare and stay a step ahead, as the Governor put it, stay on our toes of any fast-moving variants that we could see in the future. I think one thing this pandemic has taught us is to expect the unexpected, but the way that we're moving towards is a good thing. It's going to help us prepare for these variants. And for those of you that have watched Biden and the feds, they are coming out with a comprehensive surveillance system, which we are also part of here in Rhode Island, to look for variants and how to address them and try to be proactive instead of reactive. The CDC is looking at these data at the county level. For consistency, we are also adapting this framework at the county level. Because we're not, at this moment, have not been reporting at the county level throughout the pandemic, we are working with the CDC now on how they are pulling our data. However, the CDC's current risk assessment, and this is something I also want to highlight that the Governor mentioned, in all 5 counties in Rhode Island, we're currently at a low level of risk. That's a great thing. We're in a good place, certainly from over the last couple of months. In some instances, these recommendations for actions people should take are the same, whether or not you're in a low, medium, or high risk category. For example, everyone should be up to date with their COVID vaccinations. I can't emphasize that enough. The vaccines are effective, they're safe, they work, they prevent severe illness, including against the Omicron variant. Get up to date with your vaccinations. Everyone should also make sure that indoor spaces, school system, others, which we have worked on across the state, are well ventilated. Your HVAC system is up to date. I feel like we've done well in that respect here in our state. However, in some instances with these new risk models, the steps we recommend may be different. And so, for example, when it comes to masking, for people that are in counties that are low risk, there is no across-the-board recommendation for masking. People can certainly continue to mask if they'd like, and it may be a good idea for certain people in certain situations, if you're unvaccinated, to consider wearing a mask. In a county that is a medium risk, people who are immunocompromised or have serious underlying health conditions should talk to their doctors and, again, consider masking in certain situations. For people that live in a high-risk county, we would recommend that you wear a mask in indoor public settings. And again, since these are going to be based on hospital rates and hospital capacities, part of wearing a mask is not just protecting people from getting severely ill or certainly dying. It's also about keeping our hospital system safe and protected and making sure that they can provide the care that we know they can to all Rhode Islanders. For people with underlying health conditions in counties that are medium or high risk, there are some additional precautions that are recommended that you take. And these steps include having a plan. Again, these are for people medium or high risk who have underlying medical conditions, having a plan in place for testing and talking to your healthcare provider about treatments that may be effective in either preventing or treating COVID, like the new antiviral oral agents that we know are effective in treating COVID. In the coming days, we will be transitioning our data pages, our websites, and our COVID prevention guidance to fit this new low, medium, and high framework. These new guidance pages will give people examples of underlying medical conditions and will lay out specific recommendations for people in each of these three tiered systems. With this new approach, we are providing you with the information and the recommendations about your risk level and are equipping you to make the best decision for yourself, for your family, and for others around you. As you exercise judgment for yourself, and I want to also highlight this, I would ask you to be respectful of the decisions of other individuals and organizations. This is just a basic life skill. Be respectful to those around you. The golden rule, it's what we should be doing anyway. You know what your risk level is, but you don't always know about the people around you. You don't know if the person that you're sitting next to may be immunocompromised and may be wearing their mask to protect themselves because they may be at risk of getting severely ill with COVID or dying. So please be respectful if someone is still wearing a mask, and if you're asked to wear a mask in certain situations, like clinics or healthcare settings, it's to protect people around you from being sick with COVID. So big picture, the move by the CDC and us here in Rhode Island to start using this new approach aligns with the general shift that the governor and Dr. McDonald have been discussing over the last few weeks in terms of getting us ready to handle COVID as an endemic disease. So an endemic disease is a disease that's here, but that's manageable and that we can address. And that is where we are now. We can make this shift because we are in a much, much, much different place than where we were, certainly over the last couple of years. Besides vaccinations, we also have these effective treatments, multiple different treatments that are effective in keeping people out of the hospital. We have treatments for people who are hospitalized, prevent people from dying. So we're in a different ballgame here. Some of these medications are now oral pills. They're much easier to dispense, much different place, and it's a good place. Because we have these tools, in most instances, we can now prevent severe illness from COVID-19, and we can prevent our hospital system from becoming overwhelmed by COVID. And these two goals have always been two of the cornerstones of addressing the pandemic, both in public health and us at the state level. With this being our new context, we are going to be able to provide you with the data and recommendations tailored to your individual risk level and at the county level. So we can focus our interventions at the state level for people who are at greatest risk of illness. As we talk about people that are at highest risk, I do want to remind people that as of March 7th, testing at our state-run sites are now going to be for people who are symptomatic and for people that are close contacts. For people who are asymptomatic, you can still get tested at many places, pharmacies, respiratory clinics, your provider, other sites, in addition, of course, to taking an at-home antigen point-of-care test. We do want to start to reserve our state resources, our state testing sites, for people who are really the highest risk of getting sick, of developing severe illness, so we can get them on treatment and prevent them from getting even more sick. And finally, as I wrap up here, I do want to once again thank Rhode Islanders for your perseverance and patience as we work our way through this pandemic. We're in a great place now. I'm thrilled. We can breathe a little bit easier, but we do still need to stay on our toes, as the governor mentioned, and we are. We have surveillance. We're working to make sure we have adequate supply of treatments. We're pushing vaccinations, but we do still need to stay on our toes as we move forward, because again, the unexpected can sometimes has been the expected during the pandemic. So thank you all. Be well.